community readiness and stakeholder involvement. And specifically, we're going to do that somewhat in the framework of PPOR, since it's relevant to the topic that we're discussing today. A few of you were in the session that we did earlier. Okay. I look like I don't have a connection here. While Laurin hooks that up, just by way of introduction, Kim mentioned CityMatCH, but what you should know about CityMatCH is that as an organization, we really have 3 hallmarks that we focus on. And the first of those is leading with an equity and justice lens. So PPOR or several other of our methodologies make sure that regardless of which community that we're helping, we're looking at those rates and leading with the fact that if some folks within the community can enjoy a certain level of outcomes, why can't all? And what public health strategies need to be adopted so that there can be equity in health outcomes. A second piece is making sure that we're helping our local health departments translate science and data into practice. So one of the pieces that you'll see in the presentation that we're doing today on community engagement and stakeholder readiness will be incorporating that around a data perspective. And this is important because we're not simply convening everybody so we can all do the latest and greatest or what we think might be effective. But instead we're doing it within a framework of looking at population level data and making the best choices about where to invest our program and policy resources. And then the third one is to focus on building great leaders for the public's health. This is, of course, very relevant here too, because one of the things that great public health leaders do is to convene others, to bring large groups together. So it's not just the public health department that's taking action, but maybe the public health department convenes, brings those partners to the table, helps them to look at a thorough assessment of the data, and then collectively and in an empowered way decide where and whether they should spend their resources. Then the health department can, of course, play that role of monitoring and evaluating the programs and their implementation and making sure that everyone stays involved throughout. So a couple of things to get us started. We're going to give you a little bit of information, and then actually what we'd like to do is give you an opportunity to do somewhat of an exercise. And we realize that you don't have your full teams here since each person's been asked to go to one session. So what we're hoping is that maybe you can make mock teams here, or maybe even regional teams, and then take this exercise back. But to get started with a few points that we want to put out here. So what is community readiness all about? We've got 3 things up here. Number 1, engaging and creating a sustainable community partnership. What we want to point out there is the word sustainable. That what's key is not that we simply convene for the purpose of a quick strike, but that the community is brought together to pay close attention to a particular issue and make collaborative decisions based on the data over a long period of time. Kim, Project Blossom has been around for
12 years.
Okay. So there's a great example. Another one that we brought from Douglas County, from Omaha, Nebraska, and showed was their Baby Blossoms Collaborative, which again was born out of PPOR. The community was assembled to look at the PPOR data analysis, and that infant mortality collaborative has now gone on for 11 or 12 years plus. Second piece, providing data and information to the community. This is the point that I've just been making, that we've convened them not for the sake of picking the latest or greatest or what everybody thinks we should do, but instead looking at a population level swath of the data and making decisions. And then number 3, creating opportunities for community members to comment on the data and describe what the data means at the individual level and at the community level. So this is really the empowerment piece of it. When it comes to PPOR, many have looked at PPOR and seen, for example, an analytic tool. Well, this is a tool that you would use to look at community level or population level data. But really what it is, what's at the heart of PPOR, is a justice tool that empowers the community to make decisions. So when you convene, when you look at the data, you have now an informed group that can make meaningful decisions that have the weight of science behind it. What is community readiness continued? We have here, we take on the role and own the process. We share stories, and we take a part in helping determine the appropriate communication strategies, the interventions, the prevention strategies, and the leadership within and outside the community. A couple of things that are important here are I've talked a little bit about that population level data perspective. We also mentioned in the previous session the importance of complementing that with the perspective of individuals. So FEMUR is a great example here, where in FEMUR, the Fetal and Infant Mortality Review, you will do an interview with the mother and get the mother's story of what happened in the case of that infant death. And that perspective of the family, that perspective of the mother, is critical to giving illustration on how individual families interface with the systems that we create within a community. So yes, it's about population level data, but it's also about the people that our programs serve and making sure that we understand their voice and their concerns. So the definition of community engagement and mobilization, we put this forth here, is the process of working collaboratively with and through groups of people affiliated by proximity, special interest, or similar situations to address issues affecting the well-being of, and this is key, those people. So a community collaborative needs to be made up of the people that we are hoping to improve outcomes among. Should be of the people. So we have the question here, why involve stakeholders? Well, one, there's this aspect of providing valuable information, recognizing the hidden factors that might not be obvious, and encouraging this sense of ownership. The involvement of stakeholders in this, of course, is going to be one of the keys to success. Several others of the keys to success, and this comes from collective impact. How many people here are familiar with the collective impact article that's been put out recently by Stanford? Came out, I believe, earlier this year.
We can make sure it's circulated or that you have access to it.
It's a great piece in that the authors of this article really put forth, I believe it's 6 definitions here that really sum up what many of us have been talking about for years, but they do it in a succinct way that really makes sense. And they say that there are these keys, that the group has to have a common agenda. So for example, if you could, Dr. Kim, in a sentence, state the agenda of Project Blossom, could you do it?
Yes.
What would it be? And how confident do you feel that the larger collaborative of Project Blossom would state the same thing or something similar?
After 10 years, relatively confident.
Okay. Can I pick on anybody else in the room that has a community collaborative, and do you feel as confidently? Is anybody bold enough to raise their hand? How many of you are participating? Let me ask this question. How many of you are participating on a community infant mortality collaborative? Okay. And do you feel that you or your agency is in the lead of that collaborative? And by lead, I mean being the agency that convenes and draws them all together. Okay. And do you also feel, of those folks that raise their hand, do you have a common agenda? Is it clear? It's Project Blossom. We've got a yes. It would be a lot more embarrassing if she said no. So number 2, they say a shared system of measurement. So again, if you're using PPOR, for example, this is the shared system of measurement. It's what makes sense to everybody in that collaborative, that you come together and you look at the same set of data, and it's that data that informs the group and helps them make decisions. Mutually reinforcing activities. So when you convene all of these different stakeholders, they all have, of course, different functions, right? The health department might be the convener. They might have a set of programs, but there's other agencies there that fill in much of the work. And the point of this is not to duplicate efforts. It's not even to compete over resources, although sometimes that's a challenge. but it's to realize that there's a larger picture that we're aiming for and that together we can each take pieces of the work. Continuous communication is fairly clear. Without it, you end up in those turf wars and other situations. Supportive environment being related, and then finally convened around real population data.
There are dozens of tools that are available to help you as a collaborative work together better, more efficiently, figure out how to do community engagement and partnership, kind of bring people together and functioning around a common agenda. They all have the same goals, so those 5 key areas of success, with the 6th one using actionable local level data. They all have that. And the other thing that they have in common is that you need to have a dialogue and you need this communication and kind of talking about these issues openly and kind of together as a team. They all have that in common. So we're just going to use one tool today that we're going to introduce to you. So first what we're going to do is just in your head, finish one of these thoughts. In my community, infant mortality is, the types of disparities we see are, or the barriers to improving our birth outcomes are. And then just shout out some of the things that are coming to mind about what your community, what it is in your community. Anyone?
It's a major problem.
Okay, it's a major problem. What else?
The barrier ones, we don't know why we have
Okay.
infant mortality issue.
You don't know why you have the infant mortality problems. What else?
It's a symptom of our community.
Okay, it's a symptom of your community. Okay. Anything else that comes to mind?
The barriers to improving our birth outcomes are early access to prenatal care.
Okay, early access to prenatal care. What else do you see?
Bad healthcare systems for the poor.
Okay, bad healthcare systems for the poor.
Barriers to the education and awareness. Lack of
Okay. Okay. So you have a lot of the answers. And I could have finished those sentences for you, having worked with communities across the United States. They all tell us infant mortality is too high, the persistent disparities in outcomes, and a lot of the things and symptoms that you see in your community are the same from place to place. So the solution to that problem is that we as a community need to come together, have that clear, common understanding of the nature of the problem and the scope of the problem, and then start to develop strategies together to address those problems. But if this isn't a new problem in our community, why haven't we done anything about it? Anyone want to answer that one?
lack of resources and priority.
Okay, lack of resources and priority. Okay, any other?
To address the root causes.
Okay, a fear or failure. And I would also say it's possibly a fear, that this is a really emotionally charged issue, right? Okay.
Marginalization, we think it always happens to somebody else, that they
That's right.
deserve it. So it's not an issue all that you do.
It's not a me issue, it's a them. Okay, good ideas. So, there are lots of different ways to generate a change process, and we're going to use one of these today. What we want to try to do is work in small groups of maybe 4 to 6 people, maybe collect around your little area, 4 or 6 people to sit around, and I'll pass out some sheets over there that are on the flip chart. And what we're going to try to do today is just build a picture of your collaborative's preferred situation, and then think about some of the ways to generate that change. Okay? So go ahead and break out, and we have some steps. Step 1 is usually where you look at the collaborative level and you try to get everybody on the same page within your own collaborative. Because you're not sitting in your own collaboratives, we're going to start with step 2, which is where you think about it from the community perspective. So this can be aspirations for your home community or your community of Tennessee or your community of infant mortality change makers, however you want to talk about your community. So the questions that you kind of want to think about in your group are, what are your aspirations for your community? What would you like a visitor to describe how would you want a visitor to describe your community 2 years from now or 5 years from now? What are some practical outcomes that might help with the collaborative your community might be able to achieve? And then what would you like to see changed in 6 months, 2 years to 5 years?
Then finally, what we wanted to do was end with a step 3 of this exercise, which doesn't necessarily have to be your flip chart paper, but can be your own personal notes. That's more of the reality-based portion of this. So if building a community collaborative around infant mortality is something that would be beneficial in the community where you live, then really what is your role in that aspect? And what are some of these questions that need to be considered? Who needs to be involved? Who has the responsibility for ensuring change? And what will it take to produce that change? So we wanted to end the session. We won't do a report out on this, if that's okay with you,
That's
Laurin.
fine.
We won't do a report out on this, but if you will just spend a few minutes in your groups again, discussing these questions, and now thinking not from your fictitious community, but discussing as individuals, what would it take for me to go back and start this type of process?
You may ask yourself, which is the right tool to use? And the right tool to use is the one that fits you and your situation or your community best. And remember, they all have the same components or elements present in them, and it's about this discussion and a dialogue and kind of having a common plan.